Appropriate treatment of PANS requires a robust collaboration between primary care providers, specialists, and parents. At the Stanford PANS Clinic, each patient and the patient's family are seen by both a primary care provider and a psychiatrist, and often a rheumatologist. These providers then coordinate with rheumatology, immunology, and psychotherapy specialists in and out of clinic. While we've found that this real-time, multidisciplinary clinical approach is ideal for treatment of PANS, we recognize that most healthcare providers do not have this set up. Because of this, we work to empower parents to coordinate medical care by making these connections between healthcare providers. The most effective parents we have met create binders with records, lab results, etc., and bring them to every consultation. They also proactively reschedule canceled appointments, use the protected communication function within the electronic record to remind providers to make referrals for diagnostic and treatment appointments, and they engage insurance case managers to accelerate approval for necessary appointments and procedures. This proactive stance expedites care by keeping their children on their medical team's radar. There is no singular course of treatment for PANS. However, researchers and clinicians with a combined experience of over 1,000 PANS cases have formulated 3 separate documents that review treatment options: psychiatric and behavioral interventions, immunomodulatory therapies, and infection treatments. These peer-reviewed recommendations were published in 2017 and can be accessed in the resources section at the end of this course activity. The core message of PANS treatment is this: intervention should derive from standard, evidence-supported, established guidelines for specific presenting symptoms, such as OCD, separation anxiety, strep, and inflammation, all of which should be administered in a prompt, multidisciplinary, and coordinated fashion. So far, Darius has been evaluated only by his primary care provider, who reached out to me for the next steps. His history, physical, and lab evaluation point to the PANDAS type of PANS. Let's return to Darius' story to focus on treatment. Here is Dr. Jones meeting with Darius' mother.
Hello, Mrs. Brown. I reviewed Darius' labs, and I'm happy to report I found nothing surprising. The MRI and EEG were normal, his bottom swab was positive for group A strep, and his blood test showed an elevated number of monocytes, which is interesting because it's something we often see in PANS, but the significance of that is still under investigation. So, looking at everything, his picture does fit with the PANS diagnosis, and in particular PANDAS, the type of PANS associated with strep infection.
So, how can he be treated?
Well, I'll send you home with some notes about the diagnosis and our plan. So let's start with his psychiatric symptoms. The separation anxiety, the obsessive thoughts, mood swings, moments of rage. Typically, these symptoms improve as the infection is treated and inflammation subsides, but there is a possibility of slow to resolve or residual symptoms.
And until then?
If Darius has a rage attack, I'd say give him space and time while maintaining safety. PANS children often don't remember what happened or why the rage started, so it's not really helpful to punish the attacks. Darius hasn't exhibited suicidal or otherwise dangerous behavior, but if a situation does feel dangerous, you should still call 911. Other parents have found that telling responders the child has a general brain condition, rather than specifically naming PANS, is an effective way of explaining what is wrong.
Why is that?
Well, rage episodes can often look like oppositional misbehavior, but in PANS, they're likely the result of brain inflammation, which calls for a different management strategy. Since not everyone has heard of PANS, this helps ensure proper next steps.
If we call 911, will they hospitalize Dari?
They might take him to the emergency department, but hospitalization of PANS patients is rare. In general, kids with PANS have difficult behavior unsuited for pediatric units, and psychiatric hospitals don't generally provide medical care. So, hospitalization is reserved for situations in which life-saving treatment can't be otherwise provided.
So far, we are managing him okay at home.
Great.
Will Darius need psychiatric medications? I hope not.
I'm going to recommend a couple of books about OCD and anxiety for kids and for yourself, and I'll also refer you to a pediatric cognitive behavior therapist. I don't think psych medications are indicated right now. You're managing things quite well, and medications may actually affect PANS patients who are flaring differently. So we'll start with our other treatments and CBT strategies. Now, let's talk about treating Darius' infection.
Okay, strep, right?
Yes, treating perianal strep takes longer than the usual 10 days for strep throat. We'll recheck him during his next visit.
Is it a problem to treat him with antibiotics?
Well, there's some debate about this. We always treat group A strep infection to prevent complications such as rheumatic fever, so long-term prophylactic antibiotics are usually prescribed for rheumatic fever. For children with PANS, continuous antibiotic treatment is not really recommended routinely. Families and clinicians together must basically weigh the severity and impairment of symptoms, the frequency of recurrences, the possibility of long-term residual PANS symptoms. You basically have to weigh that against the known risks of long-term antibiotic administration to both the child and the community. The decision about whether to continue antibiotics may best be made in consultation with a pediatric infectious diseases specialist.
That seems down the road.
I agree. For now, if Darius doesn't respond to antibiotics, we'll double-check for infections we didn't find, like, say, chronic sinusitis or a tonsillar abscess.
Got it.
Now, inflammation. Recommendations for immunologic therapy for PANS are derived from treatments from other post-infectious autoimmune conditions and other neuroinflammatory disorders like Sydenham chorea, which is another post-group A strep illness, lupus, vasculitis. So the recommendations basically depend on the severity of PANS symptoms and how long the illness has lasted.
Does Darius need immune system therapy?
In addition to treating his strep, we'll follow recommendations for recent onset, mild to moderate cases like Darius's, which includes considering non-steroidal anti-inflammatories, NSAIDs, and referring you for cognitive behavioral and supportive therapy. If his case becomes moderate to severe, we could escalate from NSAIDs to a course of corticosteroid.
What are the risks with those treatments?
Well, both NSAIDs and corticosteroids can cause gastritis, and because NSAIDs can also affect his kidneys, if Darius stays on them, we'll continue to check his kidney function every several months. Corticosteroids, in particular, can have multiple side effects, which we can discuss if we decide to administer a course. For now, I think we should start with Naproxen, which is easier to give, twice daily versus 3 times for ibuprofen. So be sure he takes it with food and drinks plenty.
This is a lot to take in. What if the NSAID doesn't work?
Well, if the NSAID isn't effective, we'll recheck to make sure that his infection has been treated and that he's not being re-exposed by close contacts. I'd check in with a CBT therapist and maybe pursue a different immunotherapy like corticosteroid. I know this is a lot of information, but it's good to have a plan. So I'd like to see you back within a week. If Darius develops pain, I'll make sure to refer you to a pediatric rheumatologist, so please contact us if you have any questions.
Well, I'm relieved that we have a diagnosis, normal test results, and a plan. What were the names of the books you were recommending? Is there anywhere I can read about PANS?
Of course. I'll include the reading recommendations and some informative websites, which includes the Stanford PANS Clinic website, along with the notes that we took from today. Also, it'll be helpful for us to keep track of Darius' medications, urinary frequency, rage attacks, anxiety, all of that in a binder or notebook. So I'll share some questionnaires that can help you track these symptoms.
Thanks, Dr. Jones.
You're welcome. I'm glad you came right in. See you soon.
Dr. Jones discussed strategies for dealing with rage attacks, how to handle possible dangerous situations, and referred the family to a skilled cognitive behavior therapist. Together, they agreed to treat Darius's Group A strep infection and initiated treatment with an NSAID in hopes of shortening the duration of his PANS episode. It is likely that Darius's symptoms will resolve, and he will return to his baseline function. If not, Dr. Jones will make sure the strep infection was fully treated. If no infection is found, he can consult the published PANS treatment recommendations, including checking in with other providers, psychotherapist, immunologist, rheumatologist, or otolaryngologist. As discussed in Module 2, Darius could have a flare of symptoms if exposed to a stressor, such as another strep infection or flu. If so, Dr. Jones will reevaluate the clinical presentation and treat him for infection, if appropriate, and possibly with immuno and psychotherapy. If Darius has residual symptoms, but no concern for ongoing infection, such as a sinus infection, it is important that his family pursue rehabilitation, as one would for any brain injury. He should, with appropriate accommodations, resume school, physical activity, and socialization. He may require physical, occupational, and pharmacological intervention, and individual and family psychotherapy should continue for remaining psychiatric symptoms.